Well, you don't have to play tennis to get tennis elbow. It's actually a lot more common than you may think. Dr. Michael Kim is joining us live in the studio with more on its symptoms and what to do if you think you have it. Good morning, Dr. Kim.
Hey, good morning.
This has got to be a big problem down here. We have a lot of people who are obviously very physically active and getting outdoors, and with that sometimes comes injury.
You know, my office manager, now my wife has it. It's
Oh,
very,
wow.
very common, probably about 1 to 3% of the population. Interestingly enough, only 5% of these patients are tennis players.
Really?
But among the tennis players, about half of them get it. But if you look at all the patients with tennis elbow, only about 5% actually play tennis. So most of the people do not play tennis.
What are some of the symptoms? How do you know if you have an issue?
Well, here, difficulty in grip, very painful lifting things, pain in the lateral portion of the elbow. And it's common in like middle age, I would say, even though it's pretty young, 35 to 50. And it's excruciating, where the point you can't even brush your teeth or pick
Oh
up
my
anything.
gosh.
It's very, very crippling.
And the age range you were saying, about 35 to 50?
Yeah, so, you know, I guess the kids are getting older and they start doing a little bit more, and it starts becoming debilitating. So the treatment options, generally speaking, fortunately, more than 90% of patients do well without surgery.
Okay.
So we brace them, we send them to therapy, sometimes we'll give them an injection, and often that's all they need. But unfortunately, sometimes it takes 6 months to a year to overcome it.
Oh my gosh. Cortisone injections, Botox, those types of things work in some cases?
Yeah, some cases, usually it's short-term relief. Long-term relief, unfortunately, 6 months, a year, therapy, brace, changing the way you do. My office manager got better just by changing the level of the keyboard from low to high.
Wow.
Because it's the angle causing the inflammation of the extensor tendon. So basically, the portion of the extensor tendon here just gets all inflamed.
Oh my gosh.
So you have to modify your activities often.
So something as simple as a desk changing of position
Correct,
can
correct.
make
Of course,
a big
no one wants to
difference.
hear it, but you have to rest. But you know, how many people really rest after they have something like that?
And who can afford to take time off of work if that perhaps is what's causing the problem?
Right.
When is the best time to have surgery if it gets to that level?
Well, usually after a year and everything fails and nothing helps, and surgery is the last resort. And unfortunately, the surgery results are very good, about 90%. And so basically they go in there, or we go in there and make an incision and clean out the extensor tendons. Are all inflamed. There's various ways, percutaneous, arthroscopic, there's many ways of doing it. But essentially, most patients are back to tennis and work full duty within 3 to 6 months after the surgery. But again, probably about 90% or more patients do not require the surgery.
Well, that's good. So it's just a matter of modification of behavior.
Yeah, and they have to see someone. I have patients walking around for a long time with it, and no one ever diagnoses it, and they simply have to go to a hand surgeon. Just go to therapy, get a brace, and they'll get better. So if you have these symptoms, it's really important to get treated.
And so as you said, do you start with your general practitioner and then go to a specialist such as yourself in hands, or how does that work?
Probably, although most of the patients I see with tennis elbow, they tell several doctors that no one really has any idea. So it's a pretty simple diagnosis. So you just have to come in and take a look, and we can send you therapy and a brace, and it's relatively simple.
All right, Dr.
Yeah.
Kim, thank you as always so much. We
Sure.
appreciate it.